So today marks 431 days since our first case of COVID-19, 62 weeks later. Hard to believe that we've come so far in 14 months and how things have changed in our world all around us. Thank goodness no one passed away. We still stand at 378 Albany County residents that fell to COVID-19. Again, to their families, my prayers and condolences. And to anyone that has a sick person. I know it's been tough on mental health. It's been tough on a lot of things, and we're going to get into mental health in a little bit. But as of yesterday, we had 58.3% of Albany County's population has received at least the first dose of vaccine. 50.3% have been fully vaccinated. We're at the halfway mark. But 18 plus in Albany County, we're at 69.7%. 69, we're almost at that 70%. So, which is all great news, going in the right direction. We're like peeking out of the end of the tunnel, right, Doc? We're so close right now, and I know people are tired of it. We're tired of it. Everyone's tired of it. And, so we're going to get into a little bit of a variety of stuff going on around the U.S. But Albany County now has administered 64,400 vaccines to date, which is a huge accomplishment. So thank you to everyone involved with that. We know the vaccine hesitation continues to be an issue. We need people to roll up their sleeves. We need them to do the right thing. We've been trying to reinvent how we give the vaccine out, how we've been delivering it. And again, I challenge everyone out there, not just in Albany County, the million people in the capital region. If you have a good way of getting this out there, especially now to the younger age group, 12 to 18, please, by all means, let us know. Email us. Be part of the solution, not part of the problem. I know I say that all the time, but we're continuing to get through this working together. So if you do need to get your vaccine, and you got any questions, like I said, talk to your pediatricians, talk to your doctor. You can come down to our health building and talk to people down there, and we'll walk you through it. So, but here's a little good thing for the people that like Dunkin' Donuts, which I don't have my coffee with me, which I actually quit caffeine for 8 years, and I've been back these last 14 months, so I got to get back off coffee. But the first 2,000 people that come through our clinics, the first 2,000, will get a $5 gift card from Dunkin' Donuts. So we'll be giving you a $5 Dunkin' Donuts card. And thank you to Dunkin' Donuts and their corporation, who've been a good partner in the capital region, in the state of New York, but here especially in the capital region. It's $10,000. They make the donation. So thank you so much for that. And to the first 2,000, you're going to get a Dunkin' Donuts card. And if you don't drink Dunkin' Donuts, you probably know someone that does. So please, by all means, come in, set it up. I still want to thank Stewart's, the Stewart Shop, for not, for being, good to us, giving us the vouchers for the ice cream, which was huge, especially when you're trying to get into that new population of kids. So thank you, Stewart's operation. We ended up doing 241 first doses at the Pfizer Vaccine Clinic at the Capitol Center, and it probably had a lot to do with the ice cream. So, sometimes it takes a little incentive for someone to come out. And as it gets warmer out, and if this weather continues, which I don't know if it's gonna, I think they were saying it's gonna dip in the 40s, people are gonna want that ice cream scoop, or they're gonna want that coffee to warm them up, either or. But again, please, we're getting through this with you. So residents have the opportunity to get the Pfizer vaccine every weekday at our County Department of Health at 175 Green Street from 9 a.m. to 3, and you don't need an appointment. Walk-ins are welcome. Again, if we've said this, anyone over the age of 60 that needs a ride for themselves or their health aid in themselves, we will pick you up, we will get you there, and we'll get you vaccinated, and we'll get you back home. So please, again, we're making it, try to simplify the process and make it as much as convenience as we can for people. And you'll see new things that we're going to be launching to get more people vaccinated. Especially, again, I've said to parents, you want to get back to summer camps being at 100%. I know people are focused on the schools in the fall, but we really need to get summer camps up and running to full capacity for parents that will be going back to work. I think the state of New York's not back until July. They're below 50%, but we came back 100% here in the county. And people are going to start coming back to work full-time and being back in the office. So we need to have that support mechanism for the parents. Also, the Emmanuel Baptist Church, 275 State Street. Anyone can show up between the time of 10 a.m. and 1. No appointments necessary. This is through our partnership with CDPHP and the Focus Churches of Albany. So please, there's other alternatives out there. Shop around, look, make it convenient. You can walk into cross gates. They let you pick the vaccine you want now, so you got the choice. Washington Army, but I think that's coming to an end. I don't know the date exactly, but they're going to be getting ready to close their doors sometime soon, I believe. But again, you can go in there and pick the vaccine that you want. So people have the choice, where before you just got whatever we had available at that time. A couple other things. Last week, the CDC announced that people who are fully vaccinated don't have to wear masks in public places. It's been an issue. I know it came out. It's one thing we talked about. We've been in dialogue with the governor's people. I know we don't have the authority to say yes or no. We can only talk about it and moving forward. But it put a lot of heartache on a lot of restaurant owners. I fielded a ton of calls on Saturday with restaurant owners that were ticked off because people were coming in with no mask on, or like, no, CDC passed it, we don't need a mask. And, it was arguments they didn't know. I just want to remind people that go visit, and thank you for supporting these local mom and pops restaurants or your chain restaurant, whatever it may be. But the workers, more importantly. The SLA has really been out there finding the hell out of these people. And when somebody gets up from the bar and doesn't have a mask on, they face a $5,000 fine. I know one restaurant owner's looking at a $10,000 fine or a loss of their liquor license because someone was moving around the restaurant. They've been really tough on these restaurants, and it's been unfair when you had Walmart and Sam's Club and all them open, and Target for the whole time, no fines, no penalties, but these little businesses that have been shut down trying to reinvent themselves, it makes it tougher on them, and we do need leeway because we're all adults, right? And I say this to everyone, this is great to have the two doctors here. I don't know if you can see Dr. G way over to the back. To talk about mental health, to talk about all this stuff, because I've said the world's changed and people deal with stress differently than anyone else. So first of all, in order for this change to apply to New Yorkers, it needs to be adopted by the governor, which it hasn't happened yet, right? So I will say that we've trusted CDC guidance up until this point, and we should continue to do so. Again, I don't agree with all the different things that come out sometimes, and I get people's arguments, but again, we're following the science. We've been doing that here, and we have to look at it. One of the things was good. We had another flight at the Albany airport open up. Allegiance went to Tennessee for the first time. Great success, fully packed. Kind of like to see the traveling, but then on the other hand, you look at pictures in Nashville, Tennessee this weekend, and it looked I couldn't believe the crowds. I couldn't believe the crowds in Florida. I couldn't believe, and people are doing it. So again, people are fed up. They're done. We got this beat. We're pushing this COVID-19 back. We're getting there. This is all going to end, but we still need people to be cautious and do their things. And one of the things I don't want to do is that people have to be challenged. If you get a vaccine for anything else, they have to show proof of it, and I was talking to restaurant owners and different people, and I don't want you out there getting into debates about wearing a mask, or, hey, do you got your passport, or do you have your COVID-19 card with you? You got to hope people do the right thing. And you can still wear your mask. You can still stay 6 feet apart and do your thing. I would imagine the governor this week is going to put new guidance out of when New York State's going to follow lead with the rest of the states in this great nation of ours. And I imagine it's going to be soon. So people bear with us. As we get guidance from the governor, we'll get out. I imagine he'll put it out before he tells us, and we'll make sure that we in tune go that way. But I know people want the mask to be dropped, and I know to all the anti-mask haters, I do read what you put out there, and I can say this, and Dr. Whalen can talk more elegant about this than myself. The flu season's been down. Respiratory issues have been down. It has helped people with COVID-19's down. It does have a good effect. I'm not saying we should continue to wear masks the rest of our lives. But if people feel comfortable, you shouldn't be ashamed to wear that mask. And if you don't want to wear it and you want to gamble, then so be it on you, So again, we have to find that happy medium as we move forward, because it is confusing with the guidance from the CDC and waiting on the state. And I think we've been doing this for 14 months, so I think people should know that even though the CDC or the World Health Organizations put their information out there, or the president does, we got to wait for the governor to decide which direction we're going into. So, However, the changes guidance would only apply to those who are fully vaccinated. So remember that. And Dr. Whalen can help me out here. I think Pfizer's 21 days till you get both vaccines, but then you got another
2 weeks.
2 weeks after that. And Moderna, same thing, 28 days. And J&J's 10. So just because you got the 2 shots, if you haven't been full, that full period of time, you still got to wait. Doesn't mean because you got your second shot or 1 shot, you can drop the mask and you're good to go. You need both, and you need that time period of where you're fully vaccinated. So please, I know people want to be back out in crowds. I know people want to be back out socializing. Everyone does. But we're there. Let's just not lose sight of how far we've come and, and where we're at. As of today, there's only 24,157 cases. And here's something of great news, 9 positive cases. I remember when we got our first 9, almost 14 months ago, how devastated we were when we started to go up that ladder. But having 9 positive cases, yes, we're almost there. The numbers are down. We're suppressing COVID. We're getting through it. Over the last 5 days, there's been an average of 19.8 new positive cases. Yesterday, the day before, it was 21.6. Which is all good news. There's currently 113 active cases in the county, which I welcome that number, and there are currently 333 people under mandatory quarantine, and yesterday that was 379, and we have 26 recoveries since yesterday, which is good news. 3 new hospitalizations overnight. There are now 15 people currently in the hospital. Yesterday it was 13. 5 patients currently in the ICU. The day before it was 4. But our hospitalization rate and bed rate and all that is at an all-time low, which does show that we're going in the right directions. Please continue to get tested. Even if you experience the flu symptoms, whatever it may be, please get out there and just get tested and do the right thing. Continue to wear a mask, cough into your arm, clean your hands, stay 6 feet apart. Dr. Whalen.
Good morning. So as the county executive indicated, I think our trends are going in the right direction, and this is good news. We are seeing less disease in the community, and I think that this is entirely attributed to the fact that we have been able to vaccinate so many people, which is a tremendous success in the county, but we are not there yet. We need to continue to work towards expanded populations and being able to get the protection that people need to ensure that they don't suffer ill effects from COVID-19. We know if we look at other countries where the vaccination rate isn't as high as it is in this country, we have seen devastating results. And those are things that we want to avoid. So the vaccination is instrumental. We are now 20 some odd weeks, I think 22 weeks into our vaccination program. We have been very successful. I think that the people are understanding that this vaccine is safe and effective. They have watched the transmission go down. People probably know someone that's been vaccinated. And have seen that they're doing just fine. There's no evidence of any side effects with this going forward. So we need to continue that important message that vaccination is key to ending this, and to continue with public health outreach and education. We have teams, and we are working with a number of community providers that also have community health worker teams that are going to help educate populations, help answer questions. And again, we know for many people, for most people, the messenger is just as important as the message. So we want to make sure that we can work with many different communities to enable that message to get across and to be able to have people, what we want ultimately is to have people have a safe space to answer their questions. To answer the questions and to get the information that they need to make an informed decision for themselves and their family. We know that there's still a lot of people that are on the fence. We know there's a lot of people that have been waiting to see how things have gone. It is your time now to step up. It is your time now, if you still have questions, to ask them, to find someone that you trust that has access to health information, that is either a healthcare professional or a healthcare worker, or your own doctor, or your own pediatrician, or the health department, because we have health educators that can talk you through this and give you the information to make the decision that you want to make and feel confident with. So this new guidance that came out from the CDC and was announced by the president is very encouraging, because we know that this means we're going in the right direction. We know that there are a lot of Americans that are fully immunized. And again, fully immunized doesn't mean you got your first shot. It means you are 2 weeks out of the shot that you got. So I think that that's good news, but I think it also makes a lot of people apprehensive, because with that guidance comes questions. How do we know that someone has been fully vaccinated? How are businesses expected to respond to this guidance? How will the guidance apply in certain situations? And perhaps most importantly, how are we continuing to protect those that cannot be vaccinated, which at this point is the population under the age of 12? So there are parents, particularly parents of medically fragile children, who do not welcome this guidance, who are nervous about it, and that is understandable. So the Department of Health, the State Department of Health, is working with the governor's office, and I hope that the guidance will enable us to answer some of these questions. We know that currently people need to continue to wear masks in crowded spaces, in places where people are traveling, in healthcare settings, and other places. We know right now, as the county executive indicated, New York State has not adopted this guidance yet, so don't take your masks off yet. We need to get answers to those questions. We need to be able to inform people, and we need to be able to allay fears. We've gotten this far. We've gotten this far, and a large part of that is due to the cooperation, the civic cooperation that we have seen with people adopting mask wearing. And we've seen positive benefits of that. We've seen not only decreased transmission of COVID, but we have seen decreased rates of flu this year. We have seen a lot of people say, gee, this is the first winter I haven't had something in I don't know how long. So masks work. Masks work, and I do think that in the framework of a post-COVID society, there will be a place for masks for those that want to continue wearing them. I know many doctors' offices are looking at, how they protect their providers. It is a different thought. COVID has changed our thought about how we protect ourselves. And I think a mask is a very effective mechanism against protection of many viruses, not just COVID. So we ask you to wait until we get guidance from the state health department. We are looking forward to that this week. We want to be able to inform people, and we want to be able to protect people. So we appreciate continued collaboration, cooperation, and working with us to get us across the finish line. We're getting there, but we need to ensure we don't make any backward slides at this point.
Thank you, Dr. Whalen. In May is Mental Health Awareness Month, and throughout my time in office, I made improvements of services and to take the stigma away from mental health to the best of my ability. And one of the things we've talked about since day 2, when this started 62 weeks ago, was to set up a hotline for mental health. It was adults at first, and then started to realize children were being affected more than adults at all ages. And like I said, people handle stress differently. Certain people have higher levels, certain people have low levels, some are in between. But it's challenging, and we all need to try to understand this new world we've been in, and that's why I kept saying early on, we got to reimagine as we go forward and how things are going to be after you opened up. But we've done everything we can to do partnerships and to work with people, and those partnerships, Better Health of Northeast New York, They're a subsidiary of Albany Medical Center. They've been part of the state medical redesign team to reform Medicaid systems, make it more efficient, improving the services, which is always a good thing. Better Health has been an important supporter of our mobile crisis team and our expansion of it. To Dr. Giordano and his staff, we've been doing this for a long time and kept redesigning it and making it not just for mental health, but veterans with PTSD and other issues. So Dr. G and his team, thank you. And they have Better Health working with their mobile crisis team and an expansion of it, ensuring we can respond quickly to serious mental health issues and crisis situations. And based on our improved services and specific matrix that we, including affordable readmissions, following up on mental health care, and medications being discounted, Albany County, our mental health department, are being awarded more than $193,000 today, which I just signed for earlier. And today we're joined by Dr. Philauer. Hopefully I said that right, Doctor.
You said it right.
I said it right, that's all of it. So the CEO of Better Health of Northeast New York, to talk a little more about our partnership and to present the check for $193,000 and to talk about mental health awareness. Please, Dr. Philauer.
Thank you so much. It's so great to be here today and to share this good news. Indeed, the state did partner with the federal government more than 5 years ago in an effort to reform care for the Medicaid population. And they set up 25 different organizations within the state. Better Health for Northeast New York is one of those 25 organizations and falls under Albany Medical Center. Benny is actually made up of Albany Medical Center, Columbia Memorial Hospital, Saratoga Hospital, 500 primary care providers, 250 behavioral health providers, skilled nursing facilities, and also equally important community-based organizations with the goal of transforming care. I'm really happy to say at the end of this initiative, which actually ended in December of 2020, Benny, that's our nickname, came out as one of the top performers, achieving most of the state goals. And we were awarded a significant bonus in high performance funds. Our board made the decision to distribute and share the high performance funds with our partners that helped to achieve these positive goals so that they could use these funds to sustain these positive changes. Because we were able to expand crisis stabilization, we actually improved the care for patients. We decreased and prevented them from going to the emergency room. We prevented them from being admitted. We provided the services when they were needed, and we helped to expand those hours. And the latest state budget recognized that by now providing additional funding to continue that. So obviously the program was successful, and we're happy to share this award with the county and hope that it will also help to continue to fund these important critical programs.
Dr. Philauer, thank you. And I don't know if you can show the check or not, but it's for 193. Don't get that routing number under. I don't want to get him. I don't want to get him in trouble, or I don't want to get in trouble. But there we go, $193,000. Thank you to everyone and Dr. G and your whole team for making this a reality, and a new partnership we did with the Albany County Legislature to add more to this, because again, mental health is the key to everything with your healthiness. And parents, take the time, talk to your children. It bothers me when I see our teen suicide going up, people with overdoses going up, and addiction, back drinking, and other things. So we do need to take the time and get healthier people. So again, thank you to you and your whole staff, Albany Medical Center, and everyone involved. Thank you so much. On another note too, I want to say, changing gears a little bit, National Public Works Week, where we get a chance to recognize incredible work our county department of DPW do day in, day out through this whole time of COVID being shut down. The men and women of DPW are in there doing their jobs. We have over 300 miles of county roadways that we take care of, 86 bridges. They also maintain the Lawson Lake County Rail Trail, and they also do Lawson's Lake and Lee Preserve. So again, thank you to everything they've done. They've done an incredible amphitheater out at our lake. If you go check it out, the stuff they have built is incredible. They actually helped us redo the Times Union Center out in front on the sidewalk when we weren't happy with the way it came out. They came in and helped us redesign it. Very talented men and women at department, and I do want to say thank you. We do have a proclamation for this week for them, and I thought it was so important to recognize them for the work that they do all the time on our behalf. So thank you, Commissioner Lisa, and everyone else out there, and Daryl, and everyone out there doing their job. So I really do appreciate it. A special thank you. So to conclude, please call the state website, go to the state website, or call their hotline, 1-833-697-4821, or go to our omnicounty.com. You can go up there and check out things, or our mental health support line, which we will be changing a little bit, and the hours will announce, because we're there and people aren't using it, which is a good thing, but we want to leave it available just in case people still need it. And Dr. G can talk about that if there's any questions, and about us eventually changing the hours. But that number is 518-269-6634, our 24-hour sexual assault hotline. Please, if there's any problems, call. You can text now. You can email. There's a variety of new initiatives. Thank you to the commissioner there and making it easier for people to feel comfortable in a situation. They might not be able to talk on the phone, and they can text it, or they can sit there and email it and get the help that they need and the protection that they need. But any questions, 518-447-7716. And again, please, everyone, continue to do the right thing out there. We're almost there. I know people are tired. We're over COVID, and we can be soon enough. But continue to do what we need to move forward. And thank you so much to the people of the Capital Region that have done the right thing, that have followed everything, and that have been part of the solution, not part of the problem. Again, thank you. Stay safe out there.